Hi everybody, welcome to today's webinar. For those of you who don't know me, my name's Russell Cartwright, and if you're new to the Public Health Communications Hub, here's a quick intro into what these webinars are about. I set up this hub with the support of Can Digital around 18 months or so ago, and we set it up as a place where those of us working in public health communications can come together and share best practice, try and solve problems together, and try and learn from each other and collaborate really. We run quite a lot of these webinars now, and recordings are available to watch via the Public Health Comms Hub. We will be recording today, so just so you're aware of that. If you've got any questions for any of our speakers, please put those in chat, and we will come to them at the end if we have time. If not, we'll follow up with the speakers to make sure you get an answer. Also, if you've got any suggestions for any future topics for things that you think it would be helpful for us to cover in one of these webinars, do also feel free to put that in the chat. So just a little bit about me before I bring in our speakers, and I'm really excited about our speakers today. We've got some brilliant speakers for you. But I've worked in the NHS in South East London for more than 24 years now, and I currently work part-time as Head of Communications, Engagement and Behaviour Change for NHS South East London, ICB. In the past few years, I've become a bit of a specialist in running behavioural science-led campaigns where where by using those techniques, we've seen some real and kind of positive outcomes to people's health. And along the way, I've won several awards for that work and developed really my knowledge and passion in that area. So now I split my time between my part-time NHS role and supporting and training other public sector colleagues to run behaviour change campaigns. So that's me, but the real stars of the show are our speakers. So I'm going to just ask them to in turn introduce themselves briefly. So Hannah, would you like to go first?
Yep, happy to. Thanks, Russell. I'm Hannah McCarthy. I'm Chief Behavioural Scientist at Better Points.
Thank you. And Dan?
Hi everyone, this is Dan. I'm from eShot, we're a digital comms platform.
Thank you, Dan. Jess?
Hi everyone, I'm Jessica Davies and I'm the UK launch lead for Space Deco.
Thank you. And John Paul? Oh, you're on mute, JP.
Hello, I'm John Paul from Can.
Thank you. Okay. Oh, there we go. Sorry. So physical activity is a really important part of the prevention agenda. I'm just going to introduce the topic, but while I do that, can I ask those of you who are here to take a very short poll? I think encouraging people to be physically active is, as I mentioned, is a really key part of the prevention agenda for health and care services, so that we can move from focusing on curing people to focusing on preventing people getting unwell. It's a key part of the kind of government priorities, and it's vital that we enable residents to become more physically active. I've spoken at a previous webinar about Dr. Mike Evans and whose 23.5 hours mantra, where half an hour a day of moderate exercise can really have results, and those results were, if it was a drug, it would be labelled a miracle cure. And that moderate physical exercise can work for so many common health problems: arthritis, dementia risk, diabetes, hip fractures, anxiety, depression, fatigue, and generally just really make a massive contribution to people's quality of life. We'll come back to those results in a moment, but just moving on slightly. Just wanted to show this. I'm not going to go through this in detail, but I think this is a really good illustration that physical inactivity and obesity are really kind of complex problems. There's so many different things that impact whether or not somebody is physically active, and so many different things that kind of need to be in place for that person to become physically active. So we really need to look at individual social environmental factors to try and enable that person to be active. So you can't just kind of focus on one area, and that's partly why we planned this webinar, really, to look at working across different fields. So
of course, yes. So it'd be interesting to see those results of the survey, because physical activity and resultant physical activity from communications campaigns is not easy to prove at all. There are brilliant examples of campaigns that get everything right. They do insight, they do audience contact, they create stories and then push those stories out, and at the end they can show evidence of a lot of interaction, but it's very hard to say whether people actually then made a sustained change in their behavior. So it'd be interesting to see, Russell, if the people on this call agree with that. So the number of people that think they can see impact on this call anyway is 0, and then there's varying degrees of confidence in our ability to demonstrate outcomes. Now, this is going to be a big problem for when there is funding and consistent requirements to deliver campaigns that will then need to have evidence of impact to demonstrate what's been done with that funding, and also to demonstrate the impact of the policy on residents as a whole. Would you add anything to that, Russ?
No, I think clearly it is something that is difficult to measure, but again, that's why we wanted to have this webinar, to give you some ideas of ways in which you can look more than just beyond your little a silo of a particular project, and also to make some suggestions of ways that your work around this can be measured. So yeah, interesting results. Clearly it's an area where we as a profession struggle to demonstrate our impact. Yeah, so I'm going to stop sharing that now, and I'm going to ask Hannah to come in and talk to us.
Thanks again, Russell. I'm going to share my screen. Bear with me. Let's hope this works okay. Can everyone see that okay?
Yeah.
Great stuff. I'm just going to move you over a little. So I've already introduced myself. Thank you again for having me today. I'm going to speak a little bit about how we evidence behaviour change at Better Points. So many of you may already know Better Points, but for those of you who don't know who Better Points are, we are a behaviour change technology company. We've been around since about 2010, and we work primarily with UK local authorities, but we do also work, put my teeth in, with some corporates such as Heathrow Airport. So a Better Points programme uses more than 40 behaviour change techniques. You can see here on the left some of the elements that go into our programmes, but we have coded our programmes and app to the behaviour change techniques taxonomy, which is why we know we have more than 40 different BCTs. And we use those to drive reach, to raise awareness, but perhaps more importantly, to actually show engagement with the activities as well as the app, and also to deliver behaviour change. Underpinning what we do is the COMBI model, and that's something that our clients like, because I'm sure that many people on this call are already familiar with it and working with it. But if anybody isn't and wants to ask questions at the end of this call, then I'll be happy to try and answer them. So the Better Points system is more than just an app. The app itself allows users to record activities and receive better points for becoming more active, for checking into services such as smoking cessation clinics and weight management clinics. And then those points can be exchanged for vouchers within the app. And also they can be redeemed at local centres like leisure centres and for swimming lessons, etc. There are also challenges that run within the app that people can win tickets or earn tickets to win prizes from prize draws and also receive medals for levelling up in a gamified experience. But in addition to all of that happens within the app, there is this more complex behaviour change intervention that exists around it. And what you can see here in this infographic is how community stakeholders are involved and engaged with the programme, how the programmes are embedded within existing health services. We work with integrated lifestyle support service providers to ensure that the rewards and incentives mirror what is happening on the ground. And then as part of this whole programme and process, we have data, and you can see in the centre of this image how that data feeds back into an admin system and allows us then to assess barriers to change, segment users, and use that kind of data and insight to then target messaging and rewards. And so all of these programs that we run, I'm just trying to move you around a little bit here, they all are evaluated, usually at the end of a 12-month period. And here you can see some pages of and examples of evaluation reports that we deliver to clients. And they include activities that have been measured. Ooh, just go back there. Activities that participants have recorded and measured themselves. It also includes details of behaviour change and more qualitative user stories, as well as lessons that we've learned working collaboratively into how we can improve the programme year on year. And here you can see some of the kind of evidence that we had from a recent evaluation report, including a 400% return on investment and increases in average weekly minutes of walking, which I'll speak more about in a moment. But at our core, Better Points has always been evidence-led. We were originally invested in by the McGee Family Trust, and that allowed us to focus on ensuring that we were delivering real change rather than just being a technology company driven by profits. Here you can see how our team and clients have access to a dashboard that includes various information such as geographic spread of users. It includes details on demographics and user characteristics. And we also get data on new user acquisition so that we can see how effective communication campaigns are being. Here you can see in more detail some of the measurable evidence of behaviour change that we can deliver. The app uses GPS tracking rather than step counting. So we're able to do things like time series analyses of how behaviour changes relative to baseline levels. So on the right-hand side here, you can see how we were able to segment people and show those that were completely inactive and doing less than 30 minutes of physical activity at baseline, and how they've then gone on to exceed the NHS level recommendations of 150 minutes. And on the left-hand side, you can see that how this augments the self-reported perceived changes that are often the mainstay of any kind of evidence for behaviour change. And we go beyond that with the quantitative data. But behind all of this data, and what of course is the most important thing to remember, is every data point is a real person. And it's the user stories that we get that really make me feel like what we do is worthwhile. And it was very difficult for me to pick a small selection for you today. But I've selected these handful of stories to really illustrate some of the different elements that I've described that go into the complex behaviour change intervention. So here is Kuldip's story, who Kuldip used to use his car all the time, even for short trips. And now he's much more interested in going out walking and using his vouchers that he manages to earn for free swimming sessions at Lambton Leisure, which illustrates the importance of integrating with local services. Laura, who was really struggling with her mental health and has found that the little wins that are highlighted by the progress dials on the homepage of the app really helped her to realise that she was achieving something every day and have a sense of pride. And Nerl, who used to avoid walking at all costs before she joined the Better Points Hounslow Challenge, but since doing so is now walking much more, so much so that she's lost weight, and has also won the Move More Hero of the Month campaign. And this shows the importance of social rewards as well, and sharing stories in a community of app users, and integrating with other behaviour change journeys such as smoking cessation, and not just focusing on one behaviour at a time. And finally, Jason, who loved the Pumpkins in the Park challenge, which shows how important gamification is for engaging people of all ages. And so I couldn't finish the presentation without saying thank you to Can for inviting me to speak today. And as the brief was around how we could demonstrate behaviour change from communications, I wanted to share some of these great communications that our programme managers have worked on with communication teams at the local authority clients that we work with. And to leave you with a question, which is, how can we work together to change lives and achieve measurable outcomes? Thank you very much.
That's great, thank you, Hannah. And just a prompt again to please put any questions for Hannah or any of our other speakers into the chat. That was great, thank you. I'm going to bring Dan in now. Dan.
Hi, Russell. Thanks, everyone. Can you see me and my slides?
Yeah, all good.
Fantastic. So, all killer, no filler today. I'm just going to talk to you briefly about using email to promote physical activity. If you don't know eShot, it's a digital communication platform trusted by the public sector. And this slide is my only flex. We have lots of customers in the public sector, and indeed eShot was originally created for the NHS. So we've been doing public health campaigns for almost a quarter of a century. But I'll admit that most of those customers still use email in a fairly basic way. So my raison d'etre tends to be getting people from the basic end of using email for comms, newsletters, to doing cleverer things like using automation. And what I want to do just in a few minutes today is talk to you about my approach to helping customers with behaviour change campaigns, and we'll look specifically at getting people more active as an example of that. And there's 7 steps, of which the most important is the measurement, but if we go through the others, we'll see how they then help us to measure, because from a technology perspective, I can't tell you how many more people are visiting your leisure centres or taking a run in the park, but I can create opportunities to track other digital behaviours, which will give us a bellwether as to how effective our comms are being at driving people to take those behavioural changes. Okay, so first off, we have the introduction, and that will typically start with something like a website, a landing page, where you will be promoting to people the fact that they can get involved in various things to improve their health and get more active. And this is one of these things which time and again I see public sector organisations fall down. If we look at this example, Healthier You, NHS Diabetes Prevention Programme, great landing page. However, to actually access the programme and access further resources, you need your NHS number, blood test results, date of the blood test, your height and weight, and there's no way to go forward in that journey unless you've got all that information. So what I would strongly recommend, when you're considering creating email campaigns and digital campaigns more generally, to encourage behavioural change and to track them, it's really, really important that we minimise the barriers to entry and capture something as simple as an email address. An email address is all you need to then be able to communicate with people, and indeed to then start measuring subsequent interactions. And this is an example from one of our customers, Colchester City Council. They have Leisure World, and they have two options: either the main leisure centre newsletter, or indeed the wellbeing health referral specific one. But the most important thing is here, we're making it easy for people to say, yes, I could do with a hand here. I'd like more information. What's very, very important is then we follow up on that, and we follow up on it well and quickly. Okay. So what's known in the email world as an autoresponder, a welcome email. Hello, thanks for giving your email address. Let's start you on that journey. Okay. So this is what I call a triggered campaign. And the reason I keep it as simple usually as an email address on the initial form is, yes, there probably is a value to segmentation, but I can do that at a subsequent step. Now I've got your email address. Tell me more about you. Tell me your age range. The very common selection we have on forms is, I do less than 30 minutes of exercise a day, 30 to 149 plus. And the other thing is, is there anything specific or unique about you which can help us tailor the information and advice we give to you? A very big customer called Sport England, they have databases in the millions, but they have very specific resources to help people, find, a way to get active which is specific to them. So in that initial stage, all we need is an email address. Then we can find out a little bit more about people. Once we have that information, we can then start to segment, and indeed we can start to automate. So when I say an autoresponder, a single email, what that tends to lead to is more emails in an automated triggered sequence. Okay. And you may have noticed on my original slide, I doff my hat to the COM-B model as well: capability, opportunity, motivation. Certainly from the perspective of what I see others doing, everyone has the capability, and we probably need some content, or we probably already have some content to address that. And in that early stage of the process, it's a good opportunity. It's a good idea to address those things to them. We also have the opportunity, every council has plenty of options, and there are so many resources now available to people, so there is always the opportunity. The third one, the motivation, is probably where we need to then go long term. And when I say email 3 in the sense of an automation 1, 2, 3, email 3 probably then leads on to 4, 5, 6, 7, 8, 9, 100 plus, when we're talking about long-term behavioral change. But when I look at what works as far as motivating people to actually change behavior and to stick with things, there'll be that initial period of desire, but they don't follow through with the action to actually start changing their behaviors. So we look at obviously the presentations aren't connected today, so I've used Couch to 5K as an example of an app rather than Better Points. But they in turn will encourage people to use other tools like Strava to track their progress. So taking people on a journey, we often talk about testimonials, case studies, the customer story. Think of email as a way to act as a guide for people on their own journey. As you start running, as you start going to the gym, as you start swimming, here are tools to help you track your progress. Here are tools to give you that motivation. And what we absolutely know is motivation. If someone's going to stick with something and make a habit, it has to be voluntary. They have to want to do it. They have to be active in it, and making it public is a good shout as well. And this is where email is a really, really useful way of actually getting people to say to the rest of the world, hey, look, I'm doing these things. This is an example from Sheffield City Council, Cycle to School Week. When you sign up and take the pledge to Cycle to School, you are offered the opportunity to put in an email address, and then they will send you the fact that you've taken the pledge and some resources for you to share on all the social channels that you have made that pledge. Because obviously you're committing to a council that you're going to get fit is less motivating than saying to family, to friends, to people around you, hey, I'm doing this, and here's my pledge. And indeed, that in turn can drive others into the same programs. Now, the other thing that that I see work really well, and I'm sure Better Points, this is a factor as well. We take motivation and we turn it into gamification. So if you've ever used Duolingo, I know it's not health, but I always think it's a great example. If you've ever used Duolingo to learn a language, you have to keep your streak safe. You have to do it every day. And you build a relationship with a little owl who congratulates you when you've done what you said you'd do. But if you don't, then you can be in real trouble. And that's where, again, when we're thinking about automation, it's not possible when we think about newsletters to send emails which are individual to each person to help them through their journey. We have to use segmentation. We have to use automation to be very targeted and send the right message to the right person at the right time. And funnily, when people are motivated to change, to change their own behaviors, they will have a high tolerance for repeated comms. So it is possible to send people an awful lot of communication via email because, can anyone remember an email they didn't read in their Hotmail account from yesterday? If you didn't see it, and don't worry about it, but it is one of these channels where you can continue chipping away at people, trying to drive them to make the behavior changes that you want. Okay. And I just wanted to share an example of someone who I've seen doing it well. Richmond have the Richmond upon Thames Move for a Healthier Borough campaign, and they have a 9-email sequence. Welcome to the program, and they signpost and guide you through various opportunities to get involved in the various activities that they have on offer, and that culminates in a 9th email, which is then a survey. How have you found these emails, and indeed, what are you doing off the back of all this myriad of opportunity that we've presented to you? So that is an interesting approach, but then, as I say, we end up in the world of measurement. So okay, we've taken people through this program. How did they do? Okay, there is a big difference between what people say and what they do. And that's where, for me, when we're creating these breadcrumb environments of getting people to share on social, getting people to click through to booking forms, when we're getting them to tell us who they are and self-select into various different segmentations for age, demographic, etc., those are all measurable insights which you can use to demonstrate success, or indeed to find where you perhaps need to optimize. Okay, so in very simple terms, what did they click? And obviously the beauty of click tracking with email is specifically who it is. So if you've done this well and you've built through that introduction, done the segmentation, and then communicated with people effectively, you should be able to tell exactly who has interacted with what content on their journey towards the behavior change that you want. The other way we tend to look at it from a campaign perspective is we tend to look at it quite holistically. So, I always get asked, what's a good open rate? What's a good click-through rate on an email? And the simple answer is I don't care. But what I do want to see is engagement overall. So even if they don't read every email, the fact that they are engaging in some of the communications lends us to believe that we are nudging people in the right direction. So that's where we quite simply have a measurement on the platform. Are people engaged, slipping away, or indeed disengaged? Are they active in the program or not? Okay, so as I say, in a very short space of time, I just wanted to give you that blueprint. Make sure your introduction is straightforward. Then you can segment. Once you've segmented, address the capability and the opportunity aspects with them, and those two things match. Okay, now you've told us a little bit more about you. Let's challenge your beliefs as to I can't do this, and indeed show you the opportunities to get active in the area. And then, like I say, the longer term play then is driving them, keeping them motivated, gamification and other techniques to ensure they stick with it. And then you measure the outcome of that from the perspective of how people engage, not just in a single email or even 1, 2, or 3, but over the course of many emails, perhaps over 6 months or a year plus. That was hopefully under 10 minutes, Russell. If you'd like to know more, then by all means, drop me a note. And if you haven't got time to scan the QR code, I'll put the link in the chat where you can either book a meeting with me, find our website, or indeed stalk me on LinkedIn. Thank you very much.
That's brilliant. Thanks, Dan. I mean, I think in the public sector, the way we use email is we perhaps underestimate the power of email. I think clearly we've probably got a lot to learn from the private sector and how they use it, and there's some good examples there, I think, in Dan's presentation of things that we could do to make better use. Just on a personal note, my Duolingo owl hates me at the moment because I've lapsed in learning Welsh, but yeah.
I think just on that, Russell, there's no harm in, you think of yourselves as a curator of content rather than a creator of content. So, there are plenty of reputable apps like Better Points, like Couch to 5K, like Strava, some which have a commercial angle, but I wouldn't worry too much about using them in your public health campaigns, because their work, they will effectively help you to achieve the outcomes.
Great, thanks, Dan. I'm going to bring Jess in now, please.
Hi everyone. So I'm Jess. Nice to see you all today. And I am from Space2Co, and you probably haven't heard of us because we're actually based in Australia and New Zealand, but we're launching into the UK on the 1st of July. So what I thought I'd do today is just talk to you about how unlocking your local community spaces can be a catalyst to a healthier and more active community, and how we can talk around that, and kind of what I wanted to bring to the table today was just a bit of different thinking. Hopefully we can have that discussion. Next slide, please. So like I said, Space2Co, you won't have heard of us yet, but we are a platform that's a little bit similar to Airbnb, but for community spaces. So our whole purpose is to connect the community to the local spaces that are available to them. We help councils, schools, community venues simplify bookings, reduce admin, and generate more revenue by making their spaces easily discoverable and bookable online. We are across 60 plus local councils in Australia and New Zealand, and we have about 250 plus community venues over there too. We've been around for about 10 years. That's a little bit about us. It's not about us today. But what I wanted to do is talk to you about the power of place in public health and what that means to the community. So we all know the importance of physical activity. Reduces obesity, improves mental health, and cuts long-term costs in NHS. But we often overlook the power of place in that. So there are lots of local spaces like near people that are familiar and they walk past every day that are just not being used, or they're being underutilized. And you might have gone to like a little Kickers or a rugby tots in these kind of spaces, but they can be used for a lot more than that. So I wanted to talk to you about how everyday spaces can help people take that first step towards a healthier lifestyle. So I'm going to talk to you about our catalyst for community wellbeing. So if we can just pop on to the next slide, please, JP. I'm the only one not in control of the slides, so I'm a bit late. What I wanted to talk to you is about our catalyst, and this is one thing that we talk about quite a lot at Space2Co, and a lot over in Australia and New Zealand. So this is actually enshrined in law in New Zealand, and it's about how if you focus on your cultural, social, and economic and environmental well-being, then communities will thrive. So our approach is grounded in these 4 pillars, and that is to make communities thrive. So when people engage in their local space, they're not just getting active, they're connecting socially, they're supporting local businesses and participating in their local culture. This then creates a ripple effect that sustains long-term behavioural change. So, for example, some of you might have joined a running club that's hosted in a local park. That's quite a big thing at the moment, but there are lots of other little stuff that's going on as well in the local area. But if you take that as an example, on the way to that running club, they might grab a coffee, or they might pick up some stuff from the shop on the high street as they're going to join their friends for this running club. They might meet new people, and that will start a positive habit loop. That single action sparks multiple benefits. So going back to the catalyst and the wheel, the economic, the social, and their health. They'll start to feel good about themselves. Because of that feeling that they're left with, they might then feel more confident to join up for a local community class. So it's just about getting people connected, they're accessing these local spaces that are available to them. It's not just anecdotal. We believe that these are micro moments that will help reduce burden on NHS by improving preventative care, like we spoke about earlier, tackle some loneliness as well. So it's not just the mental health, it's also it's not just physical health, it's also mental health, and getting people to just connect with people that are interested in stuff similar to them. There's a lot of like knitting clubs as well that goes on in these spaces, and then activating these local places, so increasing perception of these places and activates the community pride and engagement as well. There's lots of local spaces that are local to me that I walk past every day. I literally walk past one massive community centre on my way to walk the dog, and I don't even know what's going on in that space until I started to pay a bit more attention to it. So what I wanted to do is align this with your priorities with preventative health. So if we can unlock these spaces, then it will help with some of the priorities that you're looking to achieve. There's a perception that getting people active can cost councils and NHS a lot of money, but these spaces are already available. They're just laying dormant in the week, for example, and it's just making it a bit more easy to access. So yeah, that's a bit about that. And then what we wanted to talk about as well is making these things measurable. So measuring those outcomes, so you can do these wonderful initiatives, but if you can't then prove ROI, I'm sure a lot of you get asked to prove the ROI on these initiatives and these campaigns, but if you can't prove that, then it kind of makes the conversation a bit more difficult. So if you use a platform like ours, it doesn't have to be ours, but if you can track the increase in space bookings, increase the revenue, and monitor footfall trends, measure the revenue uplift and engagement in those local spaces, and then report on the engagement metrics, that helps turn the warm and fuzzy outcomes into quantifiable impacts. So that's what our platform helps do, but it's not enough to just feel the impact. We want to show it. So our platform helps make these, helps measure those changes in the community engagement, and helps local communities thrive is really what we want to focus on. I have also put in a little case study on the next slide, but I'll share this because I know that it's a lot of information. But fundamentally, there we have some. We worked with St Heliers, which is in Auckland in New Zealand, and they had loads of underutilised spaces. They had no capacity to handle more requests though, so they came on board with us. We ran a targeted social media advertising campaign to attract new hirers and a video ad campaign to promote the centre. And then this then led to 100% revenue growth. Diversified hirers, so local businesses started to come in. They started to have karate classes, yoga classes, just by making the space more available to the local community. And then this increased the programming, so they had more activities going on, that it became more accessible for the local communities to get involved in, because there was more things that they might want to get involved in. So my whole point is really to use the comms to promote local spaces and make activity more accessible to the local areas, and make health feel more local and part of daily life, and then drive engagement through storytelling and visibility. So that is, I know that I've not taken 10 minutes, but that's kind of my speech done. But my 4 key takeaways would be to use comms to promote local and accessible activity, make health feel local and part of everyday life, and drive engagement through storytelling and visibility, and measure and celebrate impact. That's a bit about me. All my contact details are there. I'll put my email address into the chat if you want to reach out and have a chat about how maybe we could help, maybe we can talk, and I'm more than happy to have that conversation. That's it from me.
Thanks, Jess. That looks like a really good way of freeing up a community asset without adding a kind of admin burden onto small organisations or community centres or whatever. And one question from me before we kind of take some from the audience, but just what would happen? Could that also be used for, like, I don't know, something that doesn't have a cost? So if the community of, say the council have got some tennis courts that are bookable but are free or something like that, could they use your product for that?
Absolutely, yeah. So if there's free space, the platform, you get all the same usage, all of the same, it's enterprise level software, and the platform won't cost you anything at that point. The only time we charge is if there's like a booking that's gone through the platform, but I'll get to that if someone wants to talk about that.
Okay, interesting. So let's see what questions we've got. Please do put any questions in chat, those of you who are here. I can see we've got a couple from Glenn. Are there any examples of campaigns with a control group that have shown an effect on physical activity prevalence or on the Sport England survey? I wonder, I guess it's probably an England thing, but Hannah or Dan, I see Dan, you've responded with some of the Sport England reports, but is there anything from either of your organisations that you wanted to come in on for that?
I don't have any specific data, but yeah, Sport England do some pretty comprehensive reporting, and indeed they have evaluation methodologies which they publish, so they kind of guide you as to how to carry out your own evaluations. But no, I can certainly ask them, but I don't have any specific insights on that, I'm afraid.
No,
they probably do have some.
From the point of view of the literature on financial incentives and physical activity, there are a number of fairly recent systematic reviews that have looked at different wearable sort of tracking devices and smartphone-based delivery of financial incentives and their impact on physical activity, which I'd be happy to share references at the end. So that is part of the evidence base and part of the literature, but with regards to specifically randomized control trials, that's something that we have recently done, a randomized control trial looking at different types of incentives to see which might be more effective. But it's very difficult for us with an app that's delivered in the real world to actually have a control group that doesn't really receive an intervention. So we're kind of limited to looking at comparing different feature sets rather than saying, is this effective against not using a financial incentive at all? But there is a body of literature out there which I'd happily share some references for.
There is another question which I think is one of our challenges. I think there is, and partly why we're looking at the kind of the whole system rather than just one specific initiative, but there is a risk that when we focus on one initiative in isolation, we might have unintended consequences. And there's been studies that I've looked at where things like bringing in and promoting a new cycle route would increase cycling locally, but it could also decrease other activities like walking or running, or and it might be that actually the people who take those up, who use that cycle lane are the people that are already physically active. It's another channel for them to be physically active rather than encouraging people who are inactive at the moment to do that. But that's why I think it's really important we try and focus on the whole system and not just little bits of it, which was why we wanted to have this conversation. Does anyone else want to come in on that question specifically, though? No. Okay. Any thoughts or observations from any of our panelists? John Paul, have you got anything to add?
I was just going to share, if it's all right, some recommendations that we've seen from other places in terms of constructing campaigns and potentially how we could weave all of these different elements together. Is it all right to share those?
Yeah, please do.
So, I mean, just to a quick reminder, if you can, we've helped run over 3,000 campaigns and more than 200 in the public health space, and we are obsessed with reducing cost per outcome, or to put it another way, getting as many positive outcomes for your budgets as possible. And our approach around ensuring that the vast majority of the target audience, i.e. inactive people, people in low-income households, are reached and are reached frequently and are given multiple prompts, simple stories about people like them taking some sort of action in order to socially norm it. And we believe not just in the savings that are made for the whole system, but also the savings that communications can make by moving away from channels that don't work towards channels that do, and potentially by connecting campaigns that Jess was alluding to about shop local, about transport and infrastructure, as Better Points are also connected with. So we've partnered with eShot and Space to Co and Better Points so that we can make all of those platforms accessible to you. And underneath that is that no compromise on total measurability, so that we can then demonstrate impact, and then the fact that we're reducing that impact. There's a lot of examples of money being spent on channels where you can't really see the impact, and that might have been partly what's behind some of those responses from the survey earlier on. Unmeasurable channels potentially delivering an impact, but we just don't know. And it's important that we move towards reliable, consistent outcome driving channels, because we have limited resource. We can't do everything, so we have to make choices, and those choices should be towards more outcomes. In terms of insight, there's brilliant events like this where people share great examples, but there's also service data, social listening, search insight for your area, examples of previous campaigns, and the borrowing of messages from other parts of the country, which we thoroughly recommend doing. You also have data sets like ONS, but also the in-platform data sets around audiences in your area, which are really useful for modeling campaigns. It's essential that you understand the platform targeting capabilities, and that you have a plan that's designed to measure the various channels. We generally don't recommend for paid media using TikTok due to targeting, X because of its reach, Nextdoor because of reach and cost, and LinkedIn, which you probably wouldn't prioritize much anyway unless you're engaging businesses. It's really important that you try and avoid above the line channels that don't give you evidence of target audience and previous efficacy in terms of driving response. But we do recommend using your estate, so your owned estate, as councils and as public sector organisations. Web, email is incredibly powerful. I think in Surrey, the eShot platform there has over 220,000 subscribers. So they're very useful and important channels for reaching people and driving awareness. We do recommend augmenting digital activity with highly targeted direct mail, and so mapping digitally divided households, low-income households, and even the households of the grudgingly digital means that you can reach people, but it is very important that that piece of direct mail, if you're reaching digitally disadvantaged people, doesn't then have a digital call to action on it, which is absolutely key. So the optimal amplification mix around driving physical activity is that owned estate, targeted direct mail, the use of email and so on, the Google platform, the Meta platform, and for younger audiences, the Snapchat platform. And then it's really important that you use those top of the line free low cost platforms to drive awareness and active consideration. But then at the conversion stage, it's not just a long wordy landing page. You've got a call to action which collects some information, which eShot could then send a nurture sequence to that individual over time, or you have connections with events and people and physical connections, and then you're able to see the long-term impact of that, multiple bookings, actual steps taken, and measured movement across platforms like Space to Co and Better Points. And when I say like Space to Co and Better Points, there aren't platforms like them. They're the only two that we've found in many years of doing these science campaigns that can feed that data back. And that's absolutely essential for then working out what communications interventions drive those interactions. And so CAN have got an agreement with both those organisations so we can feed that data back in real time and measure what we're doing at the top of the funnel that's affecting outcomes at the bottom, and then over time reduce the cost per action. So it costs the organisation less and less over time to drive that physical behaviour, meaning that you can get a lot more outcomes for your budget. So just in summary of what we've learned, it's really good. It's really important to start at the UX. Are they going to be asking to sign up for better points and to take lessons, and make sure you can measure that. Use a mixture of email, direct mail, owned channels like out of home, and then augment with paid digital. Make sure your campaigns are always on rather than a little sort of 2-week burst. And that means that the platforms can learn, and you get machine learning, which means you can optimize. And then obviously report as you go on cost per outcome, and then connect it with other campaigns, like, for example, bus adoption or bus consultations or shop local or early years campaigns. By connecting all of these things together, you'll get more and more outcomes for your budget. And if you want to talk to us about any of these sorts of things, you can speak to Matt or me or Russell at any time. But that was just a quick whiz through what we've learned.
Thanks, JP. See, we've got a question from Bola in the chat, which is a good one, and it's about the impact of weight loss medications. It's interesting. So Bola's question is, how do we envisage increased access to weight loss medications will impact the effectiveness of nudging people to a healthier lifestyle? Anecdotally, people are sharing comments like, "I'm not doing any hard work. I'll take tablets to reduce my weight." And that's interesting because my personal experience of that is the opposite, but again, it's anecdotal, it's not scientific. But a good friend of mine has recently just completed a course of the weight loss jabs, lost 3 stone, and has started coming to parkrun with me again for the first time in 10 years. So he's lost the weight, and that's given him the initiative to be more active, which is, I guess, the way it's meant to work. But yeah, I don't know whether anyone's got any thoughts on that. I can see Leanne has put a response in the chat, but anyone else want to come in on that?
Yes, Russell, I do think there is something around positive intent around your health and intercepting that point, which could be looking for vapes, looking for weight loss jabs, looking at gym memberships online. And that's why I think Search Insight can be really useful to understand what's on people's minds. We see news articles, for example, news articles about weight loss jabs driving subsequent Search Insight, and being able to search volume, and being able to intercept that positive health intent wherever it is online, and then connect those people with multiple opportunities. So yes, weight loss, a running club, swimming lessons, is really, really useful. I think as well around thinking about always on campaigns, for example, around Wimbledon, putting lots of opportunities for people to book tennis courts, for example, is something that can work really well. So when people are naturally a little bit more motivated than normal to take action, you can then be there presenting them with an action to take that is measurable.
Thanks. Hannah?
Yeah, I think really just to echo the emphasis on spillover effects, and we often see how and indeed our model is built on the premise that people often are not motivated at all to lose weight or be physically active. What they're motivated to do is obtain a voucher. And so when you meet somebody where they are with something that they really want, then slowly over time they become more intrinsically motivated by the behaviour itself. And we see time and time again, particularly in the user stories, where people started doing one small step towards being more healthy, and then it grew and grew and grew over time. So typically, I think in the literature, it's more likely that someone's going to start with physical activity and then start thinking about eating more healthily and potentially lose weight as a secondary, rather than starting necessarily with diet and healthy eating and then moving towards physical activity. But I do suspect that we will see those kind of spillover effects as people start to feel lighter, feel more energetic, feel more confident perhaps to go out and join clubs like Park Run, or simply just to be seen out and about exercising in some way, shape or form. So I think it's likely to be positive. And the other thing that I'm no expert on, but I don't believe that we have any understanding of the long-term effects or the maintenance effects following the weight loss jabs. So I think that we need to be aware that people might rebound, and to be ready to help and support people if that's the case. And hopefully that can be through engaging with simple physical activities, and then understanding if people have maybe slipped back into older eating habits when the weight loss jabs are finished.
That's great, thank you, Hannah. I can't see any more questions. I'm just going to go around as speakers and just see if you've got any kind of closing points before we finish. So Jess, I'll go with you first. Sorry to put you on the hot spot.
Oh, no, I think from me, it's just, the purpose of getting people active and just getting people to start to make those step changes in any way possible, I think is the goal. So I think, by comms thinking about the kind of outcome data as well, I think it can only help benefit people.
Right. Dan?
Yeah, I think my main piece of advice would be think about these campaigns as always on campaigns. There should always be a set of assets that will help someone to drive behavior change, and you should periodically review them, but set it and forget it and automate it. We've kind of got into the bad habit of just using whatever awareness day it is to do a little bit of work and then forget about it again. I would take a fundamentally different approach. You've probably got all the assets already, set it up, automate it, forget it, come back to it periodically.
Great, thank you. JP?
I would say, yeah, really do consider the user experience at the other end first. Get that right, and then when you turn the brilliantly targeted marketing on, you'll be able to see the impact happening. And that's not just about return on investment and about measurability and data. It's actually about the sense of satisfaction in seeing that the impact of all your work is actually changing lives, which I think is why we do what we do.
Absolutely. And Hannah?
Well, absolutely, and it's hard for me to say anything more following JP. I think we probably should have wrapped up on that statement, but I think there is one practical thing that's floating around in my head that I imagine that possibly people on this call may be thinking about, and that's always money. Nobody really wants to ever think about what things cost or talk about the money. But what I would say is that often these things, particularly when you're talking about complex technology and apps and so on and so forth, there's often a fear that it's just going to be way out of budget. Everybody's struggling for money. It's not easy to justify budget. And I think I would just part by saying, don't be afraid to ask. It's probably not as expensive as you think, and that there are many companies such as those on this call that really are driven by wanting to make a difference and price accordingly and work together collaboratively to deliver as much value as possible in a way that is affordable. So don't let that put you off if that's something that maybe is in the forefront of your mind, just to tackle that one. Bring it back down to base values.
That's great, thank you, Hannah. Just from me, I mean, I would echo Dan's point around, always on. I think we are guilty in the public sector of running activity around awareness days and things like that, and we do lapse sometimes into tick box exercises really, rather than kind of meaningful stuff, by not having things always on. And just on physical activity, it's complicated. It's not, no one's saying it's straightforward. There's, we said at the start how many things influence it, and it can be hard to measure. But I think today there's been some examples of you can measure it, and you can make the best use of what you've already got. All of our organizations will have email software and things like that, I'm sure, and there's ways you can, without breaking the bank, use what you've already got differently to have impact and have measurable impact. So thank you. I'm gonna close this there. Thank you so much to everybody who came, and a huge thank you to all of our speakers.